Nitze. Hello. I'm Cihuapilli Rose Amador LeBeau, and this is Native Voice TV. Welcome to the show. Well, as you could see, we are socially distanced. We have plexiglass, we have our sanitizer, and we have our masks. So my guest today, I'd like to welcome Cihuachimalli, and you have to say your name in Spanish because I can't.
I will.
So please introduce yourself.
Thank you. And just started with my mask to, be a good role model, but I'll take it off so that we can understand each other better. My name is Cihuachimalli. My spiritual name, my Mexican name, which means woman warrior with a shield, and my name representing today, Corina Herrera-Loera, and I'm here with the Santa Clara County. And currently serving the county as a public information officer, serving our community.
And before COVID, what were you doing?
So I was actually a deputy probation officer.
Okay.
Well, still am, but they pulled me, as a disaster worker to support our county during this pandemic, to serve our community, specifically the Spanish-speaking community, but also supporting with interviews like this.
Great. And you're also a trustee on the Alum Rock School Board.
I am. So many hats I wear in the community.
You do.
So currently the board vice president for the Alum Rock Union Elementary School District.
And you're doing an excellent job.
Thank
so
you.
Congratulations on that.
Thank you.
So, this is our second show on COVID. And, our community has a lot of questions. And I have to say our Indigenous community has been mostly impacted in Santa Clara County by COVID, by being positive, by, their families. I guess because a lot of people work in essential jobs, and plus we may live in smaller quarters and have multi-generational families in our families. So there's a lot of things that have come up, but why don't we start by you telling us, I know there's a color system or coded system for the state, and where our county is and what that means, what the impact of that means, or what that means.
Okay, yeah, happy to share that, because it's good news for our community, right? So we've moved from the red tier to the orange tier. We started at the purple, which is the lowest level, then we got to the red, and then as a county, we've moved up to the orange tier. And basically what that means, it's less positives, based on the, total number. Doesn't mean that we're out of it yet. So I want to make sure that our community understands that, because sometimes people think, oh, we're out, we're in orange, we can do things like we used to.
Everything
we're not there yet, because if we don't follow, still social distancing, the 6 feet apart, wearing our masks, making sure we're safe when we're with others outside of our household, we can easily go backwards. So we can easily go back to the red and purple.
And we were actually at this point back in June, and then we just fell off the wagon and the numbers went way up. And I think it's because we were doing so well. So we really have to be careful in maintaining the what we're doing right now to keep the positives as low as possible. And what we did was we asked a lot of our community to ask us questions. What do we want Corina to answer? Because there's a lot of, misunderstandings of the protocols. And as behind you, we have one of the billboards that we have here at Conexión. And in our programs, we have our Day Worker Center open, and everything is socially distanced. We have hand sanitizer, we have washing stations for people when they come in. But there's a lot of things that, ways that people become positive from their own families, and they don't understand how that happened. And so some of the questions that I've been asked to ask you are things like, my family's having a baby shower, and we have a large family, but it's only going to be our family. Is that okay to have something like that?
So it depends, right? Some of us have a large family, and some of us have a small family. So it really depends. So I'm gonna go over some of the guidelines, and then ensure that you're following the guidelines as you have your baby shower. Like, for example, if I want to have a baby shower for my sister, I might just have my sister and my mom, and that would fall under the guidelines. But once you start inviting other family members, that's when we start getting into trouble. So for example, the gatherings right now, we're allowed to have up to 3 households. So if you include, you pick, right? Whether you include your tia, your neighbor, and you, that's 3 households already.
Okay.
So you can only include up to 3 households, and then you have to keep. Even when you're in the celebration, it doesn't mean you take off your mask and start, taking pictures together. You still got to maintain 6 feet distancing, social distancing, wearing your mask when you can, only taking it off when you're eating or drinking.
So when you say the 3 households, and one household has maybe 7 people in it, and another one, so we would probably recommend outdoor activity.
Definitely recommending outdoor.
Wearing your mask.
Yes.
And keeping that
yes,
distance.
wearing
which is
the
hard
mask
with family because you want to hug everybody,
right? I know. You want to be close. You want to hug everybody. And, some of the things, so even under the tier orange, so, what we're allowing now is more indoor dining and indoor gatherings, but still with certain limitations. So just because it's allowed doesn't mean it's recommended. So it's always recommended outdoors, keeping it outdoors, making sure that we follow all the social distancing. And then also we're making sure, we want to make sure that those, that are elderly, maybe are sick, maybe have diabetes. And I know we've heard this message over and over, but we can't forget that, right? So you might not want to, have your tia, or if you're, diabetic or have another illness, you might want to stay home. Right. Another thing very important to keep in mind is the symptoms. If I'm feeling a little bit sick, if I have a slight fever, I want to stay home. Stay home. Don't take the chance, because you don't want to be that person that gets somebody else sick and then they end up, instead of celebrating, you might be at a funeral next. So you don't want to be that one person to pass it. So, and it's very serious. I've lost people close to me in my community that, I mean, at first I had nobody that I knew, right? Then all of a sudden I'm like, somebody passed away, and then another person passed away. And so it's real, and we're doing better. So it's good, I don't want to bring the downhill and that, negative feeling. It's uplifting right now. I feel good as a county employee, as a community member. We're doing better, but we're still not out of that place where, it's dangerous.
It's difficult. We had a marketplace, an Indigenous Marketplace this past weekend here, and we had all the booths, 6 feet apart. We had masks, we had hand sanitizer for everyone, and we monitored that everybody kept their distance. But I came and I saw a lot of people I hadn't seen for months, and you want to hug them, but you can't. You have to wear that mask, you have to keep your distance and wave and hi, nice to see you, but you have to remember how dangerous it is to hug everybody, and you just have to remember that at all times. And there were times I'd see someone who was like, oh, there's so-and-so, but hi.
Yeah, and even that gathering, it's ceremonial for us, right? It's a ceremonial gathering. But even then, even though I know you and I know you're in ceremony and we pass, I still can't give you a hug because I don't live with you. And so, for now, we just get to continue to say hi from afar. And, as I mentioned, even though all these things are allowed, it's still discouraged. We're still discouraged from doing them. But we know that, we get to open up a little bit more and we're allowed, but we're still discouraging.
So right now you can eat at, I guess 25% of restaurants can be filled, and there's the outdoor dining. But I think it's a little unclear when you take off the mask when you're dining, because I hear people saying, oh, I had it off because I was just about to, because I was going to be eating. But is there any protocol for that, or is it?
Yes, so we should, we should still maintain our masks on at all times. The only time we take them off is when we're eating or drinking, and then we put it back on. And so, out dining now, we're able to dine indoors, which is, more dangerous because we're indoors and the particles, we're closer and it's in an enclosed space versus being outside. So we still recommend outside. Again, like you said earlier, we want to eat outside, we want to be outside. And if you're indoors, maintain the social distancing. If it's somebody outside of your household, the 6 feet, put your mask on, wash your hands, regularly. But you have to keep your mask. We get to keep our mask on if we want to get out of this pandemic.
Good. And you mentioned about taking pictures, because I see that all the time, and mainly on Facebook. You know, people and I go, "Where's your mask?" Oh, we were just taking a picture. It's like, but you know, you're taking a picture, but still, during that. I guess people don't understand that how quickly you could get it.
Yes.
You know, it could transfer to you in a matter of seconds. All it just needs is little particles to fly over. It's while you're taking a picture, maybe. So I think it's important for people to understand, I guess, how dangerous it is.
Yeah.
How dangerous it is. And it is great that it's not getting better, but because of the protocols, it's getting better.
Absolutely. So we must maintain our masks on, even when we're taking a picture. And if you want to take it off, by all means, just maintain the 6 feet apart. So, take a picture from farther away. You can't have close selfies
or stagger. That's what we do, like this.
Or, I mean, right here, I would be safe with our mask off, a selfie where you're right behind me, right? We're 6 feet apart. We have a plexiglass in between.
Right.
But, you just can't take that chance because you might be the one to get it, and then pass it on to your grandma or your mom or whoever you might go back home to. Some of us live with our parents, and you don't want to be the one. So just always be safe and wear your mask.
Right, because I probably would get sick because I'm old. But,
no.
But the young people might not get sick, or they'll just get a cold or a sore throat. But it's the elders we're concerned about, spreading it to an elder or a grandma, or
Yeah, no, and really we don't know, right? Because I learned about a young person. I mean, to me, 35 is young, that had it, and you just never know. So you might be the one to get it, and you might not. We don't want to lose any more lives to this, and so we want to make sure. And I want to thank you for taking it so serious, and making sure that the protocols are followed here. Conexo, you mentioned, and in the community, like during the event that you mentioned, taking those precautions is a must. Making sure that not only are we safe, but our community is safe. That we take care of everybody else as well when we're responsible for others.
Right. Let's see, what else did they ask us? How do the rules apply to family? Okay, so how does this apply to, I know, with food, I know, like in our day workers center, we don't have everybody putting their hands in food, you know, and serving and this and sharing utensils. But say someone has a family potluck, or is a potluck a good idea, and they bring food, and it comes from different households, and what would you recommend there?
Definitely no.
Okay.
Potluck is a no, and I know that that's big in our community, right? We love sharing our food. My mom's, recipes are the best, and so I always want her to cook wherever I go because I want to take her dish, still trying to do my best to learn her dishes, but right now we should not. And so I love the fact that you mentioned that, like in the day workers program, you have it packaged already. So that's what we're recommending, even like, for example, at the gathering that, ceremonial gatherings that we're having, we want to make sure that things are packaged already. And that, if food is involved, for example, I've been to a funeral where it's an outside gathering, but that the food is packaged. And so I know we want to feed our families, we want to have that, space and time, but we want to make sure that we keep the food packaged and that it's only handled by one entity who has followed, all the precautions to make sure we're all safe.
Exactly, or have it where you bought it somewhere.
Yeah, exactly, absolutely.
Okay, let's see, what else do we have? Let's talk about testing a little bit. Should everyone be tested? Who should be tested? How often? Can we talk about that?
Yes, so I'm gonna give you an example, right? I'm an essential worker, I work with the community, so I get tested every 2 weeks. Not, because it's mandated, but because I wanna make sure that I'm safe if I'm interacting with, for example, here, even though we're 6 feet apart, you just never know.
Right.
And so we do have various places in Santa Clara County where, it's provided for free, and it doesn't matter if you have insurance or not, and everybody can get tested. We are encouraging everybody to go to, like for myself, I have Kaiser. If you have a medical provider, they're supposed to be providing the tests, especially if So here's that place where I would, put an emphasis in is if you're feeling symptoms of, if you know somebody close to you that tested positive, then it's, like mandatory, right? Because you don't want to pass it on to others.
Right.
You don't want to have it. So if you're feeling the symptoms, follow all the directives, stay quarantined, and as soon as you can get to, a place to get tested, get tested. And those of us that are essential workers working with the community in one way or another, that we get tested, often. There's several places, like I mentioned, in Santa Clara County. I know our fairgrounds are open every weekend, so they have testing there, and they also have flu vaccination. So, you can actually do both there. So there's no reason why we shouldn't be tested. It's free, and they won't turn anybody away.
I've been to the fairgrounds a few
nice.
times. It's very easy, and
Nice.
you maybe wait 5 minutes, for your test. You just drive up and pull the mask down, and they poke you in the nose, and and you get the results in about 2 days. Aki's testing right here in this building out front every Friday.
Oh, nice.
Every Friday they're testing. We've tested here a few times, but there are a lot of places you can get tested. But I do hear people saying, I don't have any symptoms. Why do I have to get tested? Or I got tested a couple months ago. Do I need to get tested again? Would you recommend people, the average public, to get tested once a month, or?
Absolutely, because some of us are asymptomatic, so we might not have the symptoms or feel sick, but we might be carriers. So you just want to, do it. It's free. It takes, like you said, 5 minutes once you're there, but it's worth saving, lives. You don't want to be the one to be carrying it and not even know, and then end up, getting somebody sick. And then another thing I wanted to mention, because I met a lady who said, I went in the beginning and they poked me, they poked me and it hurt so much, I'm never going back. So I want to share, that those tests are not, I don't know if you got tested initially and know the difference, but there is a difference. So initially they were poking, and I say this
Kaiser
because
changed.
Kaiser changed because, so I went with my husband to Kaiser actually, and that's when I saw the experience he had versus the experience I had. We were in the car together, so he had the one that poked him, and then I had the one with the swab. So that's when I learned, like, oh my God, that looks so painful. And, he was really in pain even after. And so, I just want to let people know that that has changed, at least for the county, right? I'm representing the county. Not sure what, Kaiser's doing or if they're going back to that. But I've had several tests at Kaiser, and it's been with the soft swab.
Oh, really?
Yes. And I want to say that with our county, it's simple. You had the county one. It's a swab.
I had both.
Oh, you had both within the county?
I had Kaiser and the county.
Okay, so you know the difference. Anyways, well, I know with the county, I've done it several times now, and it's a simple swab. It won't hurt, and you'll be in and out, like Cihuapilli mentioned, within 5 minutes.
Yeah, the county was so much more gentler.
We're gentle. We are gentle.
When I first went to Kaiser, but of course it was at the beginning because I went over there for an appointment, and they said you have to have a test first, so I had to go get the test. It was horrible. I mean, they stuck it down your throat and down your nose, and it was like, whoa. Yeah. And then I went to the county, and of course we had some testing here, and they were very gentle, and I thought, I'm not going back to Kaiser. So I was wondering if they got any better. But the county was great. I mean, it's not bad at all.
We are gentle.
And the
we
one
have
that Aki does, you do your own.
Oh.
They coach you in doing it. So, no, they're not painful at all. Just Kaiser.
Yeah.
Unless I've
so
changed.
those of you who got scared, before and went in the beginning and got traumatized.
Everybody should do it.
Yeah, because I heard some lady, a lady in the community say, I will never do that. I had a horrible experience. So I just want to let people know to come back, and give it a chance.
It's not painful at all. It's very easy. And I think maybe initially they weren't sure what they were doing. This was way back, probably in, I think might have been June. So it was
Early.
way back at the beginning, and it was like, whoa, that was something. But no, now I've been going pretty regularly, at least once a week, to the county, to the fairgrounds.
Oh, good.
And it's not bad at all. Just in and out of there, and just drive right through, and you can make an appointment online.
Nice.
But that's what I was going to ask you too. There was some question by a few individuals about why do they ask for Social Security and ID?
So,
And ethnicity.
so, we keep our information organized. And so even if you don't have it, you won't get turned away. And in regards to the ID and, ethnicity, I mean, all this information, we take it to keep, again, the information organized, to collect data, and we also ask for addresses so that we know, one, who's being serviced, who's being left out. I mean, there's several reasons that we take it, right?
Which zip codes?
What zip codes? Because, in the beginning, for example, we noticed that certain zip codes, people that lived in the area weren't getting tested. And not only weren't getting tested, but weren't even receiving the, information to even go get tested. So then we, brought in different, providers and community, like this organization here, this channel, to make sure that we provide this information out to our community, that it's, it's for everybody. It doesn't matter, of your immigration status, and that, we should all be getting the resources, not just tested, but also if we test positive, right, that we have the resources that we need. So those are some of the reasons that we gather that. We want to make sure that everyone in our community, regardless of where you live, regardless of, who you represent, that it's, that we're providing the appropriate resources that are equitable across, the board. Not that one area is getting more than the other.
It was my understanding that it was also so they can build the appropriate resources for the testing. Well, would you have any closing remarks for our audience?
So yes, absolutely. Just to make sure that I know that we all have so many questions, but at the end of the day, just to stay safe, stay healthy. If you're feeling sick, stay home. Don't go to work. Don't expose others. Also for organizations, right? You're a leader of a organization. You take care of many people. That if you are in charge of businesses or agencies, that there is support for all of us. So everybody from those of us that are essential workers doing our best to those of you that are leading organizations. We have phone numbers. We have websites. So for example, we have a business line for those that might have a question about I need to reprimand an employee. I don't know how. Am I doing it right? And so their phone number is 961-5500. Office of the Labor Standards, 866-870-7725. And then those of us that just have a question that maybe wasn't answered today, make sure to go to our county website at sccgov.org/COVID-19. We have all of our resources there. We have people ready to answer any question you might have, whether you're overseeing an organization or from the community themselves. Continue to wear your mask, continue to stay social distance, 6 feet apart, continue to, stay home if you're not feeling good, take care of yourselves in order for us to get out of this faster and that we get to the yellow, which is our next level, and then soon out of this pandemic.
Thank you for joining us and
you.
your wealth of knowledge, and we'll all stay safe. Thank you for joining us on Native Voice TV.